Lawrence wants to know how accurate, if that's the right word, ultrasound scanning is. He says he's referred patients in the past for ultrasound and it's never failed to find hypoechoic areas, suggesting damage.
Yeah, I think there are upsides and downsides to every form of imaging. Back in the old days, I used to take X-rays of patients' spines, and we'd pick up all sorts of things which we thought might be relevant at the time, but clearly weren't. You treat the patient. If you were to re-X-ray them, and that's not always a good idea, you might well see the same things on those X-rays. So and the patient's pain's gone, so it's irrelevant. There's loads of stuff you'll see on ultrasound scans which can be irrelevant, and you have to use clinical judgment to decide, whether it's relevant. We'll look at a picture maybe of a gallstone. So I don't know if people can see this picture, but you can see the gallbladder here, the big black blob. So that's got bile in it, and you can see this little collection of, it's either one stone or a collection of stones. It's not entirely clear, and you can see the characteristic shadow underneath. So ultrasound is really good at picking up things where there's a lot of contrast and where the thing that we're looking at is of a reasonable size. If it's a centimetre or two across, it's nice and easy, and because it's white and it's a stone, so it's going to reflect the ultrasound waves back to the probe. You're going to get a good picture of it, and you're going to get a shadow. The shadow really helps to pick it up as well. If there wasn't a shadow there and we just saw the white blobs, they'd probably have a polyp. In other words, it was a less dense structure, but this is clearly a gallstone. So the question then is this relevant to the patient's back pain? It's reckoned that 80% of people that have gallstones don't have any symptoms at all. I think that quite a few patients with gallstones do get pain. Sometimes it's intermittent pain, and it's not always coming around, under the breast area and around laterally. Often it's in the quadratus lumborum area where, us as practitioners, when we're getting our thumbs in there and feeling it, we'll feel their muscular tension, and the patient feels it, and it's a back problem. But one might argue it's because they've got a gallstone there that maybe intermittently is blocking the drainage of bile out of the gallbladder and making the gallbladder uncomfortable.